This is in addition to the Health Shift. My name is Marie Haycook. I'm a nurse practitioner at the Russell Physicians Clinic here, and I am taking new patients. I like to specialize and really care for those patients with chronic conditions such as diabetes, hypertension, high cholesterol, as well as exams, yearly exams. And I'm going to be talking about a few summer topics here as summer's going to be coming up. I'm going to be talking about hydration, sunburn prevention, and water safety. So we'll get started. Hydration is really important with summer coming up and everybody outside mowing their yards, little kids playing outside and such. Staying hydrated before activity actually helps in the long run. And then also hydrating during activity or work is going to help prevent any complications. Actually, when you're working out in the heat, it's recommended to drink 1 cup or 8 ounces of water every 15 to 20 minutes. This translates to 3/4 to 1 quart per hour. And actually drinking in shorter intervals is more effective than drinking at larger amounts infrequently. Hydration after work or activity. Most people need several hours to drink enough fluids to replace what they've lost during the sweating and such. The sooner that you get started, the less strain that you place on your body from dehydration. It's a few tips of what to avoid when staying hydrated is energy drinks. They contain caffeine and sugar. And drinking several energy drinks per day can actually raise your caffeine levels enough to affect your heart. High caffeine levels can be risky when added to the strain that's placed on your body by the heat. And many energy drinks, like I said, contain lots of sugar, such, as soft drinks, which adds more calories to your diet. Also, alcohol can cause dehydration. Drinking alcohol within 24 hours of working in the heat can increase the risk of illness. So we can also talk about like sports drinks, Gatorades, Powerades, that sort of thing. In general, eating regular meals with adequate water intake is sufficient to maintain water and electrolyte balance. For prolonged sweating lasting several hours, sports drinks with balanced electrolytes are actually another option to replace salt that is lost in the sweat. Heavy consumption of these drinks can add unnecessary calories to your diet due to the added sugar. So next I'm going to talk about sunburn prevention. As Kansas, our temperatures get pretty high, so it's important to prepare for sun exposure. If you plan to be out in the sun for an extended period of time, during the day, the middle of the day, the sun's rays are strongest from 10 a.m. to 4 p.m. And even on the cloudy days, it's important to protect your skin because UV radiation can actually pass through the clouds and cause a sunburn. So it's important to seek shade when we're outside. Areas that are shaded actually receive less UV radiation and can reduce your chances of developing a sunburn. Trees, umbrella, or some sort of structure like a porch or a tent can protect or can provide shade. Sunscreen is still recommended if you're sitting in the shade because your sun is going to be exposed to some UV rays. So sunscreen, the active ingredients in the sunscreen provide a physical barrier to the UV light radiation. They typically contain several active ingredients and often a mix of physical and chemical agents. As far as looking for an SPF, you should look for a sunscreen that is labeled as a broad spectrum, which means it protects against both UVA and UVB rays. However, most people don't really apply enough sunscreen to achieve the SPF on the label and can overestimate their level of protection. So a general rule is to apply the sunscreen twice a day to achieve better protection. So what SPF is best? That's a pretty common question. According to the American Academy of Dermatology, they recommend using an SPF of 50 on the exposed skin. And studies show that you get 20% more protection from SPF of 50 compared with SPF of 30. However, if you're using like the lower SPF, it's better tolerated on the skin, then it's better than not using any sunscreen at all. So how much sunscreen do you need? You should apply the sunscreen generously to all exposed skin about 20 minutes before exposure. Exposed skin is any skin that's not protected from the sun. So good application, the one approach is the teaspoon rule, which means a generous teaspoon of sunscreen to each leg, the front and the back torso, and a generous half teaspoon to each arm, face, and neck. Applying less than this amount can reduce the sunscreen's SPF rating. You should reapply sunscreen after sweating, rubbing the skin, drying off with a towel, or swimming. The traditional advice is to reapply it every 2 to 3 hours while you're outside. Another area to protect is your lips. That's something we don't often think about. Protecting your lips with a lip balm containing of an SPF of 30 or higher and reapplying frequently. Some cosmetic products, foundations, lipstick, moisturizers contain sun protective ingredients, although they're not really truly effective, and they usually have a label that says SPF of 15. Another common question is, does sunscreen expire? Manufacturers recommend throwing the sunscreen away when it's past the expiration date. Generally, there will be a note on how many months the sunscreen is valid after opening. However, sunscreens can last longer than their recommended use. Use common sense to assess if the sunscreen, doesn't smell correct or have the consistency is not right, then discard it. So another sunscreen protection is clothing. In addition to sunscreen, you should consider covering the exposed skin, using a wide-brimmed hat, a long-sleeved shirt, and long pants. A hat made of tightly woven material like a canvas can provide shade to the face, ears, and the back of the neck. Sunglasses that provide 100% UV ray protection can also reduce the risk of cataracts. Wraparound glasses provide the most complete protection. Children are at higher risk than adults for becoming sunburned for several reasons. They're usually unaware of the risks of sunburn, so they won't put the sunscreen on, and they may be more sensitive to the sun, resulting in more DNA damage in response to the same amount of sun as adults. So sunscreen application applied regularly for children is imperative. So next I'm going to talk about water safety. Drowning is actually the third leading cause of unintentional death for all children ages 0 to 19. And it's the leading cause of injury-related death among children between 1 and 4 years old. Drowning often occurs silently when an unsupervised child is near the water, and it only takes a few seconds to drown. Children can actually drown in just 1 inch of water, such as in the bucket, outside, a bathtub, wading pools, and toilets. In addition, hot tubs, spas, and open waters, such as oceans, rivers, and lakes, pose a drowning threat to older children. So some things to consider about drowning. When a child is submerged for 2 minutes in water, he or she actually loses consciousness, and brain damage can occur within 5 minutes of water submersion. With each additional minute the child is submerged, the severity of the outcome worsens. So some tips for preventing drowning. Never leave a child unsupervised near water at home or around any body of water, such as a swimming pool, lake, ocean. A good tip is also to learn CPR. of infant and child that's first aid. In case of an emergency, you can perform CPR and help save the life and in the long run reduce the severity of the injury. Do not rely on personal flotation devices or swimming lessons to protect your child. Install four-sided isolation fencing around swimming pools. Make sure that there's rescue equipment around the pool, such as tubes or ring buoys and a telephone that's near the pool with emergency numbers. Do not allow children to dive into waters less than 9 feet deep. Insist that a child wear a U.S. Coast Guard approved personal flotation device, such as a life jacket when you're boating or sailing or canoeing. Teach the children to stay away from bodies of water that have become frozen during the winter. Children can drown by falling through thin ice. Also teach children that swimming in an open water is different than swimming in a pool. Some more tips, removing toys from the pool that would, make the child more interested and so they're not tempted to reach for them. Always empty blow-up pools after use and put them away. Do not let your child use a diving board in a pool that is not approved for it. Avoid pool slides as they're very dangerous. Keeping electrical appliances away from the pool to prevent any electrical shocks. And do not allow riding tools near the pools. There's different sort of age-specific safety tips, such as, up to a year-old infants, they obviously need to be closely supervised by an adult. In any, less than an inch of water, they're more prone to be curious and jump in the water, and then we don't want anything bad to happen. So just the bottom line is making sure children are supervised around any body of water, swimming pool, doesn't matter the depth or anything, just to prevent any drowning events. So thank you for tuning in, and I hope you all have a great and healthy summer.